Okay, so I decided to use my downstairs bathroom as my confessional. um, Yesterday was a very crazy day for me. Like, thought I solved one problem and another problem happened. So I was still having the allergic reaction with the bumps all over my body, shortness of breath, and the pain in my chest. So I was reaching out to the VA all week, constantly sending secure messages, calling people, waiting for phone calls back, and I wasn't able to get anybody to respond to my messages. So I finally ended up getting a phone call from from the director of women's health from the VA, just to follow up on the biopsy I had yesterday on the axilla um, lymph node on the right side. And she was able to take me seriously when I was expressing my pain, my concern, and she told me to go to the urgent care after knowing that I had already gone on Sunday to the ER. She told me to go to the ER again. So her concern was that this pain that I've been having in my chest and the shortness of breath could all tie into me having a blood clot in my lungs, which is pulmonary embolus, completely scary. People die from that. So, and apparently I'm at high risk because I have estrogen, which is one of the factors. Sorry, I'm having pain in my head now. Okay, I have estrogen, which is one of the high factors, and then I also am a cancer patient. So at high risk, those are top two high risks of getting blood clots. With that being said, I took it seriously, even more serious than me trying to contact people all week about it. And I, told my stepfather, because it was just me and him at home. I wasn't feeling good. So I had taken like the first portion of the day off of work, and I had planned to start working later on into the evening and make up my hours today, which is Friday. But as you see how the story goes, you're going to see how that did not happen. So I ended up then going to the urgent care, no, the ER, Wellstar Cobb ER, and they took me seriously because they knew they had just saw me the day before. That's where I went for the biopsy. So they had like paperwork and stuff in from that. And then they knew in the system that I literally was just there on Sunday to the ER. So now they're like, okay, this woman's either a hypochondriac or something serious is going on. So they did their best to try to quarantine me and keep me away from other people due to my immunodeficiency right now. And she gave me an ECG. That was the first thing she did. Apparently I had cardiac something. And it's when your heart is like racing. Like I think it's like 60 to 100 beats per minute is normal, and mine was like, I think it was like 119 beats per minute. Don't know why. I didn't feel anxious, anything like that, but apparently now that might be a side effect of the chemo, me just having a racing heart, which is why I'm awake right now, actually, again, earlier than I anticipated, was because I woke up covered in sweat again this morning with a racing heart. So I digress. Back to the hospital. They do the ECG, get those results, everything looks normal besides that, and then I get my vitals. I think they said, my blood pressure was actually good this time, not low, within normal ranges, and then I think they said my pulse ox was like a little low, but they didn't put me on oxygen or anything, they just monitored me. And then so they took me to the back. The lady right away explained everything I explained to you guys initially about being high risk and wanting to do something called a DIME test and run more blood panels, as well as a pregnancy test, which I laughed at because if you guys know me, like, there are no prospects. There is nothing to be looking for down there. But anyways, I did it anyway. And also she was on the fence of whether or not she needed to do a chest x-ray or order a CT. I was like, well, I just had a CT and there was nothing wrong with my lungs. And then she's just like, well, you know, things change after chemo, which is true. That was kind of naive of me to say. Things do change after chemo, apparently. So I was like, okay, sure. She's like, but we want to limit the radiation as much as possible since you're going to have radiation therapy. So if we get that DIME test back, and even with those two factors, it shows that you are not showing any influxes to have a potential for a blood clot, we're not gonna do the CT. So I was like, cool, I'm on board with that. That's great. So get the results back. Turns out that it is elevated. I think it was 109 when it was supposed to be below that. It was like, no, not 109. It was like above it, like way above it. And so she's like, okay, so we're not gonna do the chest x-ray, we're just gonna do a CT. So we got a CT done, and that experience just triggered apparently now I have PTSD from the chemo reaction I had, because I've had contrast before, never made me feel hot. I literally, like I said, just had an MRI with contrast the week before, and I also had the PET CT the week before or the following week. And I had no issues. It didn't make me feel hot when they added the contrast. I actually felt cold. But now, post having the chemo reaction and they inserted the contrast, I literally started breaking down. Like, I was in there crying. I was banging on the machine because I thought like I was having a reaction, like instantly triggered, thought I was gonna die again. And the guy comes in and he's like, what's wrong? And I'm just like, I'm burning all over again. And he's just like, what are you talking about? I was like, I'm burning, I'm not supposed to be burning. And he's like, oh no, that's the contrast that happens to people. I was like, no, that's never happened to me before. It's always been cold. It was cold going in and then it turned really hot. And he's like, yeah, some people that happens to them. He's like, some people feel cold, some people feel hot. I was like, well, you didn't tell me that. I've always just ever felt cold. So I literally basically overreacted to the contrast because of fear that I was having, an anaphylactic shock, or I don't even know if that's what I had, an episode to where my whole body felt like it was on fire and I couldn't breathe and I was dying. On Thursday last week, so exactly a week from that episode, I get contrast put into my body. It feels like I'm burning all over again. Not to that degree, mind you, but just the feeling of my body getting warm, undisclosed, I should say, completely triggered me to having like a little mental breakdown. So luckily, he was able to get all the images before he ran in. And then he apologized for not letting me know, but he assumed, since I said I had contrast before, that I experienced that symptom, not just feeling cold. So, it wasn't his fault. That's completely something I need to work with my trauma therapist now on, is kind of training my brain to not expect the worst now when I'm giving any kind of medication intravenously. I don't know, it's too much unlearning I have to do. There's too much baggage now that's going to be packed away for me to unpack later. But I have a great trauma therapist and she's going to help me. Anyways, I digress again. I got wheeled out of there, and then I was just in the blue zone, which is supposed to be patients that are waiting to be admitted, that are COVID-free and clear, or just patients that are waiting to be discharged. So I was in there and I was concerned because I said I'm immunocompromised. Granted, I had put on 2 masks the entirety of my stay there, but I was literally there. I went in, I kid you not, and about about 3 o'clock I got there, and I did not leave the emergency room until 10:20 last night. And mind you, that emergency room is literally 10 minutes from my house. So, with that being said, the amount of time I was waiting in the emergency room just to get anything going, like moving and stuff like that, I had spoken to my chief, who was very concerned that I was there in my condition with my compromised immunity. Sorry, I'm short of breath again. And she just didn't feel like I was getting taken care of or taken seriously. But I tried to be on the side of the caregivers. I'm gonna go to nursing school. I have to be able to understand situations like this. I have to be able to, understand that I'm not the only person that's in a crisis or that's having a crisis at any given moment. So I'm very understanding and I'm very patient when it comes to my health and getting care. But it's when I am able to express myself and express how I'm feeling and advocate for myself, and I'm not being taken seriously, that is an issue for me. But I have no problem waiting to be seen. Someone came in while I was sitting there and she got bitten by a dog. So, go ahead. I have shortness of breath, but I'm still breathing. She might have rabies. Go ahead, take care of her, clean up her wound, make sure it's not infected. I am, not an irrational person by any means. But, it was just such a long, grueling day. And before that, I had lost my military ID. Something told me, hey, go get some fresh air. So me and my stepfather went on a walk on a trail that we've never been on. Ended up losing my military ID. It was in my back pocket. Don't know if it was on the trail. Don't know if it was in a grocery store. Don't know if it was in a parking lot. I don't know. We circled back. My mom circled back. We could not find it anywhere. So now I have to go ahead and get me a new military ID, which is going to be a whole other hassle. Since I literally just got it last year, they're just going to be looking at me like I'm some irresponsible person, which granted right now, I got a lot going on. So something falling through the cracks is not surprising to me, but I didn't expect it to be that. I need to do better. So I have that, and also I haven't even started any of my schoolwork besides the introductory posts for both classes online for my nursing school, which started on Monday, and they're due on Sunday. So I have that weighing on me as well, and I also have to drill this weekend with my gaining command virtually. I've never mustered with them before. I'm not really sure what it's like doing a virtual drill weekend. I'm hoping it's low maintenance because I'm supposed to be resting all weekend. I actually have a doctor's note to be out of work today just because he gave me a steroid yesterday that gives me insomnia, so I haven't really slept too much. Last night. I didn't sleep in the hospital. I was waiting for those 7.5 hours. So I'm gonna crash eventually today sometime. And the weekend I need it. I have the steroids I'm supposed to be taking for 3 days. He gave me some intravenously, and then they tried to give me morphine. But another thing was the university. Apparently I took some of the cough syrup I had that had codeine in it. I didn't even know. I didn't even look. I just took it because it was prescribed to me from the Navy. Granted, it was 2019, but I'm a hoarder, so I don't throw anything away, and I don't like taking medicine, so it was still a full bottle. And I've been really sick with a cough. Granted, it's a dry cough, not a productive cough, since the chemo. So, and every time I cough, my chest hurts and I have a headache. So I was trying anything to stop the pain, to stop the coughing. But, and I didn't even think about it. I took the cough medicine. I was like, oh, they require me to do a drug screening for nursing school. Let me just go do the drug screening. And so I just hopped all over there, provided the sample. Then she calls me and she's like, well, you tested positive. what medications are you on? And I was like, a lot. I'm going through chemotherapy. Like, that's my first thought. Like, there's a lot. I don't know what could possibly have popped. I can provide you all the prescriptions I have. Forgot I even took the medicine. She's like, oh, well, to be specific, you popped for codeine. And I was like, oh yeah, I took some cough medicine. Like, which I can't take again now because if they want to retest me, can't be looking like I'm a druggie now, even though I'm on like 15 different things. Excuse me. So I bought some Ricola. Since there's very little stuff I can take anyway. Over the counter that's not approved by my oncologist. So, yeah. So now even that happened yesterday. I got that information yesterday that I was positive. I provided her a photo of the bottle that had the label on it, clear. It just didn't have the prescription information because I think like Aylin ripped it off a long time ago. So like I said, it's from June 2019. It's an old prescription from when I was sick in Bremerton. So, yeah. But it had like the clear dosage and everything on it. It just didn't have my name on it. And then I also, because I'm a hoarder, like I said, she's like, oh, well, I'm gonna need paperwork showing that it was distributed to you. I said, no problem. I'm sure I can find it. I keep every single thing I get from medical. Guess what? I had that discharge paperwork from the hospital because apparently I went to the Bremerton Hospital, and they gave me the the paperwork that said the medicines they distributed to me, and my name was at the bottom of it, showing that medicine, guanfacine plus codeine, on their 100 milligrams, 10 milligram dosage, all that was on there, and it was on the bottle. And so they asked me to like zoom in, take a photo of the bottle with me in it as well, separately, and then send the paperwork. So I sent the paperwork. And the lady's gonna tell me that, oh, that doesn't work for us. We need to see the prescription actually on the bottle to know that it was prescribed to you. And I'm like, what are you talking about? My discharge papers show the list of prescriptions that were prescribed to me, and I showed it to you front and back. I'm not understanding how this isn't sufficient. And then she's just like, well, literally, that can be anyone's medicine, and you just happen to have a prescription from 2019, and you're just using that while taking someone's medicine right now. I was like, lady, are you serious? I was like, are you serious? I was like, go ahead and just forward the paperwork to whoever you gotta contact, and then have your people call my people later. I was like, I don't got time for this. Like, there is no reason for me in my current circumstance or ever to be trying to abuse codeine. I'm over 21. I'm 32. I can go buy alcohol whenever I need to. Like, codeine? Really, lady? This is 2022. There's other things people are trying to get. Like, whew. Can't make no sense to me. But anyways, after that incident, that is when I realized that, that's when I got the call from the director of women's health from the VA who, told me to go to the ER. So it was like lost ID, failed drug, screening, and then the, what's that thing called? And then the ER visit. So I didn't get home until 10:30. And then I didn't actually get into bed until after 11. And I was able to sleep until I think it was like 4. But she did tell me that the steroids they give me causes insomnia, so be prepared for that, like I told you guys before. So when I woke up covered in sweat. I had to change my clothes again. I took my temperature first thing when I woke up because I was afraid, okay, again, this might be a fever. I'm having a fever. Why else would I be sweating for no reason? And then when I took my fever, 97.7 again. And I sleep with the fan on in my room. We had AC throughout the evening, and I don't even have a heavy blanket. My mom specifically went and bought me a very light quilted blanket. So that's not the issue. So my sister just chalked it up, and my heart was racing too. Like, again, like what they said, with the fast-paced heart rhythm. I woke up to having that feeling, and I haven't been able to go back to sleep since. So my sister's a pharmacist, and she's at the house now. She chalked it up to the chemo. These are all just being crazy, terrible side effects from the chemo. So with that being said, I did have my meditation music on. I tried just like focusing my breath and trying to slow my heart rate down because I wasn't even breathing heavily. I was just literally at rest, and my heart was just like, felt like it was gonna beat out of my chest, and I'm like, okay, this isn't normal. But then I just like got up, and I'm like, okay, let me go ahead and give an update while I'm feeling good, while I'm not feeling tired yet, because apparently I'm supposed to crash again. I have to fill those prescriptions, which is taking the steroid that I got last night again today. So hopefully I can get a nap in and then take that, so I'm up like throughout the day and not up in the middle of the night. Um, but yeah, I was like, okay, let me go ahead and do something that makes me happy, and that usually is a stress reliever for me. So I'm making cocoa bread. So if anybody wants some cocoa bread, I'm making some. Leave a comment if you're in the area. But yeah, I've been wanting to start back up my bread baking because it really makes me feel good and makes me feel grounded, and so I'm gonna go do that since there's a lot going on that I didn't have control over yesterday, and I'm just trying to refocus and control what I can right now. So yeah, let me know. Let me know what you guys think of this video. Like, comment, and subscribe.